Effect of metabolism on elder peoples. As we discussed, the phase 1 metabolism is affected in elder, but phase 2 metabolism is not affected. So we have to give the drugs in elder, which is metabolized by phase 2. Here the example of diazepam. Diazepam, it is generally used as a sedative hypnotic drugs in the treatment of anxiety, and it is metabolized by phase 1 metabolism. And what is the effect if we give diazepam to these elder people? And in elder people the phase 1 metabolism is affected. It means no metabolism means decrease in metabolism, means labor workers are low, no work done. If the drug is not metabolized, not excreted from the body, where is the drug in the body? And it will causes increase in the plasma concentration and increase the adverse effect. So use the drug which is metabolized by the phase 2 metabolism. And we have the another option. So if you are not you are not giving diazepam, so which drugs are alternate from the same category? From the same category, same family, diazepam small brother is lorazepam, and which is metabolized by phase 2 metabolism. So you can use lorazepam. There is a question, explain why lorazepam is preferred to diazepam in elderly. Explain why in one line. So you have to write. If you write lorazepam is metabolized by phase 2 metabolism is enough. If you write diazepam is metabolized by the phase 1 metabolism is enough. If you write the phase 1 metabolism is decreased in the elder, also acceptable. Okay. So this is about the metabolism. Now excretion, the last event in the pharmacokinetic, is associated changes in the renal excretion of drug. Renal excretion of drug decrease in the elderly. The example is given is gentamicin, because gentamicin is a water soluble drug. And why the renal excretion of the drug is decreased? Due to decrease in the renal blood flow, decrease in the glomerular filtration rate, decrease in the tubular secretion, decrease in the number of functioning nephrons. So excretion of the drug is also decrease in the elders. There is one question. Serum creatinine is not an accurate indicator of renal function. Why? Explain in one line why. Serum creatinine is not an accurate indicator of renal function. Now, what is creatinine? Creatinine, it is a product of the metabolism of the creatine phosphate in the muscles. In the muscles, generally in the muscles, there is a metabolism product of creatinine phosphate to creatinine, and this creatinine production is used as a marker to detect the renal function. To detect the renal functions, we are using creatinine as a marker, which is the product of the creatinine phosphate in the muscles. So the creatinine is produced by the muscles, but what happened in the older people, in older persons, the production of creatinine is decreased. Why? Due to decline in the muscle mass. So it is not accurate indicator. If the muscle mass is decreased, if the creatinine production is decreased, we cannot say the kidney is not functioning properly. So if in the result of creatinine test in the elder, the creatinine concentration is decreased, it will not indicate the kidney is not functioning properly, because in elder people there is already muscle mass is decreased. So due to muscle mass decreased, decline in the muscle mass, the creatinine is decreased. So we cannot say the uh, kidney is not functioning properly. So that's why the serum creatinine is not an accurate indicator of renal function in elder. So if there's a question, explain in one line why serum creatinine is not an accurate indicator. So just if you write in elder there is a decline in the muscle mass, okay, accepted. Renal, there is a decrease in the renal excretion of the gentamicin and the digoxin. Decrease in the renal excretion of the gentamicin and the digoxin. If the drug is not able to excrete from the body, where is the drug? In the body, in the plasma. So it will increase the plasma level and it will increase the toxicity, because every drug has some stay. It will not stay for forever. Every drug has its time, 8 hour, 12 hour, 24 hours. In that period, a drug should be removed from the body. If it is stay for the long time, toxicity. But in elder peoples, the renal excretion of the drug is decreased and the plasma concentration is increased, which is responsible for the toxicity. So what is the question? Explain why in elderly gentamicin. What is gentamicin? Antibacterial antibiotic which kills the bacteria. In elderly, gentamicin and digoxin should be given in lower doses than young, because in elder, what should be your answer? Renal excretion of this drug gentamicin in digoxin is decreased. If you write decrease in the renal excretion, accepted. Decrease in the renal excretion of the gentamicin and digoxin. Second question, although penicillin is excreted by the kidney, dose reduction in elderly is not necessary. Now just we see the question. Some drugs are should be given in the lower doses. Why? But the penicillin no need to lower the dose. Why? Now look at the first question. Gentamicin and digoxin should be given in the lower doses. Why? Because no excretion. And if the patient take the repeated dose of gentamicin, repeated dose of digoxin, it is built in the plasma and responsible for toxicity. But for the penicillin is also excreted by the kidney. But the dose reduction is in elderly not necessary. No need to reduce the dose. Why? And in the elder, the renal excretion of the drugs is decreased. Because what is the penicillin? Penicillin is antibacterial antibiotic from the beta lactam category, the most important antibiotic. We will discuss this penicillin in the your next block, principle of disease. Penicillin. So penicillin is an antibacterial drug which kills the bacteria. In elder people, its dose reduction is not necessary. Why? Because just write down, the penicillin has greater therapeutic index. What is therapeutic index? Therapeutic index is a distance between, or it is a distance between the, or we can say it is a ratio of toxic dose and effective dose. In simple words, in simple words, if the dose of penicillin is increased by repeated administration, it will not create adverse effect because penicillin has greater therapeutic index. Therapeutic index means the margin of safety. This drug is safe. The penicillin will not produce any adverse effect as the gentamicin and digoxin. Penicillin having the safe therapeutic window. The penicillin is safe. It will not produce any adverse effect, any toxicity. That's why the dose reduction is elder is not necessary. Not necessary. If you reduce, okay, but not necessary. It means that the excretion of the penicillin is also reduced. Excretion of the penicillin in the elder people is also reduced, but the dose reduction is not necessary because the drug is safe, because the drug has high therapeutic index. Drug will not produce any toxicity. And there are some pharmacodynamics in the elder. Now we just discussed the pharmacokinetic. It is the pharmacodynamics. Effect of drug is determined by the drug receptor interaction and the homeostatic regulations. What is drug receptor interactions? Now, age related changes in the pharmacodynamic. What happen? Suppose if we give some drug to the elder person, it will create problem. Example, morphine. What is a morphine? Morphine is a opioid, generally analgesic. It is used for the severe pain. If we give the morphine to the elder people, it will produce more effect because the sensitivity to the receptor is increased. Increased sensitivity to the receptor. So reduce the dose of morphine. Warfarin, due to decreased synthesis of the vitamin K dependent clotting factor, warfarin may cause bleeding in the elderly. So need the dose reduction. This warfarin, if this dose are excess high, it will create life threatening problem like the bleeding, hemorrhage. Morphine, if the dose is high, respiratory depression, death. Warfarin, bleeding, death. So these drugs should be reduced the dose in the elder peoples because increase the sensitivity to the receptors. Diuretics. What is the diuretics? These are the drugs which causes excess urination. Now, these drugs are generally used in the management of the edema and the management of the hypertension if the patient is more than 80-year-old. Diuretic is a drug of choice, mainstay in the management of the hypertension in the elders. So, if you give the normal dose diuretic, it will may cause the postural hypotension. What is this postural hypotension? Postural hypotension. Hypotension means decrease in the blood pressure. Postural means upon standing. Upon standing. So if the elder people on the diuretic, and when they change the position, when they change the posture, when they will stand, it causes the hypotension. So reduce the dose. Reduce the dose. And also anticholinergic drugs like atropine also causes the confusion. Atropine, you discussed in the parasympatholytics. Atropine, it causes the confusion. So this drug should be, the dose should be reduced. Also beta blocker, elder may have response to the beta adrenergic receptor. Now which are the beta blockers? If less response, they will give the less response. Suppose example, isoprenaline. What is the isoprenaline? It is acting on also beta 1 receptor. So less tachycardia with isoprenaline because age related problem. This no response to the drug, less tachycardia. Tachycardia means, tachy means increased, cardia means heart rate, increase in the heart rate, it will be less. Propanolol, less bradycardia. Brady means slow cardiac rate, and less tachycardia with vasodilators. So this is due to change in the pharmacodynamics. So beta receptor, why? Because the sensitivity to the beta receptor is changed, that's why there is a less effect. What is the summary? Sensitivity to beta receptor is changed, that's why less effect. The most important, atropine causes less increase in the heart rate, less effect of the parasympathetic nervous system on the heart due to pharmacodynamic, not normal. And the most important, the NSAIDs, non-steroidal anti-inflammatory drug, which relieves the pain, mild to moderate pain. Increased side effect of drug to NSAIDs causing hemorrhage and renal impairment. It will cause the renal impairment. So in elder people, which NSAID is safe? Paracetamol. Use only paracetamol in elder peoples instead of other drugs like the ibuprofen, diclofenac. No, they are causing the renal impairment in the elder peoples. So use only paracetamol, which is more safe. It will not affect the vasodilating prostaglandins in the kidneys. So if I ask which is the safest NSAIDs in the elder people, the paracetamol. No ibuprofen, no diclofenac. What happened with the ibuprofen and the diclofenacs? They cause the renal impairment in elder because increase the dependence of the aging kidney on vasodilating prostaglandins, and that results from the age related decrease in the plasma flow. So best NSAID is paracetamol. And this is the summary chart for the all we discussed in the lectures. Just I will revise in short time. First one is absorption. Why there is a decrease in the absorption in the elderly? Because ketoconazole, antifungal drug, due to decrease the gastric acidity. Means what happens generally? There is an increase. The the pH is basic. That's why this ketoconazole is acidic drug, not able to absorb. Iron, calcium, and vitamin B12 decrease in the absorption. Why? Because decrease the absorption of active transport mechanism, as we discussed in the lecture. Increase in the absorption of the levodopa. Why? Because decrease the activity of metabolizing enzyme. Decrease the bioavailability of, sorry, increase the bioavailability of levodopa. Why? Because decrease the activity of metabolizing enzyme in the stomach. No metabolism, no excretion. Increase the bioavailability. Increase the bioavailability of propranolol. Why? Decrease the first pass metabolism in elder. Decrease the volume of distribution of which drug? If the decrease in the volume of distribution, it increase the plasma concentration. Which drug? Gentamicin. Why? Because gentamicin is a water soluble drug, and in elder there is decrease in the body water. Digoxin is concentrated into the muscles, but in elder there is decrease in the muscle mass. Increase in the volume of distribution. If increase in the volume of distribution, decrease in the plasma concentration of drug, diazepam, because diazepam is lipid soluble drug, and in the elder the body fat is increased. So increase in the volume of distribution and decrease the plasma concentration. Warfarin, free plasma concentration is increased because warfarin is acidic drug, and in elder the serum albumin is decreased because acidic drugs bind with the serum albumin. Quinine, quinine is a basic drug. What happened to the basic drug? In the basic drug, the decrease in the free plasma drug concentration. Why? Because in the elder the serum alpha 1 acid glycoprotein is increased, where the basic drug bound. Effect on the excretion, diazepam, no, because the phase 1 metabolism is decreased. So used lorazepam. If the phase 1 metabolism is decreased, increase in the plasma concentration, adverse effect. Gentamicin, decrease in the excretion, may cause kidney toxicity in elder. So because due to decrease in the renal excretion, so reduce the dose of gentamicin. Decrease the excretion but no toxicity. Penicillin, no toxicity because of the safe or wide therapeutic index. Yes, renal excretion is decreased, but still drug is safe. And the last one is lorazepam, should be used, which is having the normal excretion. Lorazepam, it is metabolized by the phase 2, and there is no increase in the plasma concentration. And these are the pharmacokinetics drugs which is affects the elder people. If you give morphine to the elder people, greater CNS depression. Warfarin, greater bleeding. Diuretics, postural hypotension. Vasodilators, less tachycardia. Atropine, greater CNS sensitivity, lesser tachycardia. Isoprenaline, lesser tachycardia. Propranolol, lesser bradycardia. NSAIDs, greater toxicity to kidney, as we discussed. And NSAIDs, greater possibility of GIT hemorrhages, as we discussed. Thank you very much for your precious time. Wish you all the best.